But as we conclude conference, we really thought it was important to hear from the people who were experts in living with scleroderma themselves, and they have more experience than anyone. So for our closing keynote, we're going to focus on the patient perspective, and it's going to be a casual conversation with some voices that I'm sure you're familiar with. These individuals are all leaders within our community, and they have offered to share stories from key moments and experiences in their own individual journeys. So without further ado, I would love to introduce our panel. Please join me in welcoming Monica Ramirez, Evan Rood, Falguni Desai, and Erion Moore. So to start us off, I would love for each of you to share a little bit about your journey and background with our community here today to frame our discussion. And Monica, do you mind starting?
Thank you, Mary. Good morning, everyone. My name is Monica Ramirez, and I was diagnosed with scleroderma 15 years ago. For me, it's a really honor to be part of the National Scleroderma Foundation. I'm a facilitator for the bilingual support group, member of the Patient Advisory Board, and the Advisory Committee for the Florida and Puerto Rico chapter. Also, the organizer of the International Scleroderma Conference. This conference is an extraordinary experience to give me this week a deeper knowledge about my health condition. Thank you so much for organizing this event.
Thank you so much for being here, Monica. Evan, I'd love to come to you next to share a little bit of your journey.
Yes, thank you, Mary. My name is Evan Rood. I'm here, I'm from Seattle. I was first diagnosed 10 years ago, but had symptoms probably about 13, 14 years ago. I currently am an architect and high school lacrosse coach. And just kind of pigging back over here, I'm very honored to be on the stage with these incredible individuals and talking about our challenges and victories in our disease.
Thank you for sharing with us today, Evan. And Falguni, could you share a little bit?
Sure. Thank you, Mary. So, good morning, everyone. I was diagnosed with systemic diffuse scleroderma and went into renal crisis on December 19th, 2019. Journey was hard, and it took a long while to get to where I am today, but you can be here. And I've been involved volunteering with the National Scleroderma Foundation for about 3 years, on and off. I'm honored to be part of the board now, and this is my first year at the conference, and I was honored to see so many warriors who are living the journey. But let's not forget, every journey is different, but everyone has a special story, and every day is a new day. So thank you for allowing me to talk on the panel and to participate in the conference.
Thank you for being here, and I look forward to your insights. And finally, last but not least, Erion, could you share a little bit about your journey with scleroderma?
Yes, Erion out of Portland, Oregon. I was diagnosed in 2008. After a few years of struggling, I was playing college basketball. Went from 6'6", 210 or 215 to about 120 pounds before signing up for a stem cell transplant in 2012, and so I'm glad to be here and sit up with this panel.
Thank you, Erion, and thank you for being here, and thank you for hosting us in your neck of the woods in the Pacific Northwest. So Falguni, I'd love to come to you first, and maybe you could share a little bit about some of the biggest challenges that you faced early in your journey.
So the biggest challenges was obviously misdiagnosis. Also, so many medications were prescribed that I really didn't know what was going to happen in my body, and I got reaction after reaction. And then remembering December 2019, on Christmas Day, when I started dialysis. I had to be wheeled in. I had lost by then almost 40 pounds, and it was very, very hard. But I came through it, and it was 5 years on dialysis. I had to learn to walk again because I was unfortunately bedridden for about 9 months. But with the help of the medical team, physiotherapy, my family, my strong faith, I've come through it. So the one advice I would give is, yes, we all face challenges, but we will be able to come through it and stay strong. Because initially I was very angry. I went through the grieving process, but you do come out of it. And look at me now. I'm a voice, and I want to build awareness for scleroderma, and we're gonna find that cure, and we are going to get through this. So thank you.
Strong start, Falguni. Appreciate that. So Evan, same question for you. What were some of the challenges that you faced early on in your diagnostic journey?
So very similar. Early on in this disease, as much of us here know, it is very difficult to diagnose. Scleroderma and other autoimmune diseases present with a whole host of different symptoms, and it's very different for each individual. So when I started having symptoms in 2010, 2011, as a college sophomore, one, as being a student, I didn't think much of it. But when I did seek help with localized swelling to my neck, shoulders, wrists, along with kind of the squeaking, the crepitus or the tenosynovitis in those areas, it kind of confused the campus physicians. And then when they, reached out to local physicians, I kind of got similarly confused, answers. And then they sent me to rheumatologists and dermatologists, all within Eugene. It's just, unfortunately, scleroderma is not the top thing of the list that doctors think of. So early on, now thinking back is kind of silly, but just kind of asking more questions and staying on top of and being your own advocate for your own medical treatment and asking more questions and really making sure that doctors aren't misdiagnosing, not actually something that you can handle, but making sure that they are looking in more spaces for treatment than just the bare minimum, which unfortunately one of my early prognosis was rheumatoid arthritis without rheumatoid arthritis, and I was just told to take Tylenol. So early on, diagnosis is pretty difficult. Thank you.
Thank you for sharing that. Now, Monica, many in this room can attest to your just very positive energy and your hopeful spirit. Can you share a little bit about how you manage to maintain that positivity and hope while managing the difficulties of scleroderma?
Yes, just two things. A strong support system. My family has been my biggest motivator to stay positive. I live in my loved one to looking for support, and the support group helped me to connect and share with other people with same experience that I have it. And the second one is education. I strive to stay educated, learning about the scleroderma. It's feel me that more in control about everything. That's my suggestion for any people that have the scleroderma. Contact with another people, have the same condition, and educate.
Thank you. Erion, what would you add to that in terms of managing, to stay positive? You always have a smile on your face. How do you manage to maintain that while also balancing the challenges?
I think a lot of it, just humor, right? Like I like to laugh with people, or at them, but just some of the things that I did growing up, I still do, you know, and nothing changed with a lot of my core group of friends or family. So the people who see me growing up or stayed with me, and then the transition of will I be here in a few years, and then every time I go home to California, they take care of me. Nothing changes. You know, if we go out, everybody still goes on their own way, and I'm still left alone in a scooter somewhere. But it just knows that they don't treat me disabled, or they don't treat me any different now. You know, or they come to my house and I'm hosting them. So it's nothing changes, just the limitations physically that I have. So I think that helps me stay positive. And I mean, there was a couple of years where I didn't see anyone, but I would tell them, hey, things are changing over the phone. But they didn't believe me until they saw me. And they was like, I couldn't even tell over the phone something was wrong. And I'm still their support. So I think that helps me focus in on other people than myself.
Incredible. Thank you for that. Falguni, could you share a little bit about how your support system has helped you in your journey?
Yes, so support is very, very important. I want to pay tribute to my family, my daughter especially. She's been my rock. She's helped me through. She was on the EMT at university, so she really stepped in and went with me for every appointment and asked the questions when I didn't have that voice, as I was still getting stronger and stronger. My poor husband navigating the insurance and on the phone for hours and hours and hours. But he went through it, right? And he had a diary of all my 18 different medications and when the refills were going to happen and what was this and what was that. So he played an immediate role. I will say for my healthcare providers, very important. They do take the time, and you have to sort of not question, but really understand why they're prescribing something, what they're doing, so the healthcare providers. Obviously, my family, I have 3 sisters. I had a sister in the UK who flew in with her family. My 2 sisters from North Carolina initially, when I was going through dialysis, they were there because I had a catheter, so helping me sort of slowly go into the down room, shower, and just, it was a journey, but they were there for me. I will say now that I've joined my local choir. So my choir has also been a great support system. So really embrace all that's around you. Use them. It's okay to say, hey, today I don't feel that good. And the one thing my daughter's taught me is confidence and courage. I had lost a lot of that while going through on my journey. And I thought, you know, I can't do this, but I can. I actually came by myself to Seattle. That was the first time. So, you know, I used to travel a lot, you know, before I got sick when I was on my business trip. But I said, I can do this. I'm strong, right? So I just want to say to you, use your support system, but use your inner strength, because that's a great support for you as well. So thank you.
Thank you. Monica, what about you? What role has your support system played for you?
My family is my rock. It's my greatest support system. My daughter Helen was been my emotional anchor and my nurse since she was 16. She's my right and my left hand in any project I undertake. Helen, with my grandson Maximus, are my continuing companion, and they are the reason I'm still here. And they motivate me to keep moving forward. I'm really grateful. I'm so grateful that I have my daughter Helen and Maximus in my life. Thank you.
Thank you all for sharing these wonderful insights. Evan, I'm going to come to you and ask, how has your perspective changed on life and personal goals since your diagnosis?
Yeah, well, so early on in my diagnosis as a young, recent college graduate, I was not paying attention to my body. I neglected a lot of things in my personal life for my work life. And that work-life balance is incredibly important. I was a young architect. I was working hard. I was getting promoted. But that didn't stop my body from trying to tell me, you're doing a little too much. Maybe 50 hours a week is not good. And it finally came to a point where after getting pneumonia, I had to stop working, and I actually, I was admitted to the hospital for about a month, and I ended up losing, similarly, an incredible amount of weight, and I exited that month at about 120 pounds, and I couldn't, for the next couple of years, work at all. So it's incredibly important to listen to your body and make sure that as you are doing the things that you love, whether it's working or hobbies, is that you meter, not necessarily limit, don't limit what you want to do, but just meter your energy, your output, so that you can do everything that you want to do.
Thank you. Erion, you're so strong for us and the community, and you always show up for us in big ways, and such a rock for so many in this room. Can you share a time when maybe you found unexpected strength or resilience in yourself along your journey?
Yeah, I think the strength and resilience, like most of you all, was from the advocating for yourself, because I was living alone and I was starting to lose my range of motion and mobility, and you're trying to find creative ways to reach in the refrigerator or even reach back to take care of yourself. And that was hard because you're like, oh no, I might lose this all. So sometimes you want to give up, but you still kind of say, nah, you try to figure out a way to make it happen. And then my fingers had split to the bone, and you could see the cap of the bone, I guess they call it, and my elbows. And my Medicare was like telling me that it's probably time that I should move to a group home or some of those facilities. And then I found the stem cell transplant. It's easier now, but at the time, looking through Yahoo, there wasn't all that access to find services, and it also wasn't covered. So going through court, battling insurance, one doctor was okay with, the rest was like, I'm not signing, you to do this trial. And so I just had to self-advocate, had to read the laws of my insurance, what would they cover, and that took a couple years until 2012 when I was approved for the stem cell transplant, which worked the week that I did it. So my health is good, just a lot of joint damage to the day that I actually had the transplant. But that was a lot of phone, emailing, waits, not knowing what's going to happen. So that probably was the hardest part of my journey. Thank you.
Thank you, Erion, for sharing that. And Evan, thinking back, over your recent journey, what has kind of resonated with you in terms of that sense of strength and resilience?
So after spending that month in the hospital, I came out with the diagnosis of heart failure, pulmonary hypertension, and I needed a heart transplant. And for the next 2 years, I, with the help of my team here at the University of Washington, looked for a transplant center that would actually accept me. And that was very difficult because as someone living with scleroderma, our cases are very challenging, especially for medical programs. And unfortunately, there are a lot of complications to a surgery like that, where it requires you to move to an area if your transplant center isn't near you. You have to be within 4 hours of that location. It also requires you to have a permanent caregiver. Insurance is incredibly difficult to deal with. And for a lot of those reasons, those different transplant centers didn't accept me. Finally, I was accepted at the University of Pennsylvania in Philadelphia, at the incredible team there, where in 2018 I received my bilateral lung and heart transplant, And in September, I'll be 6.5 years. Thank you. And through all of that, similarly to all of us on stage here, our family, our friends, our community, including our caregivers in the medical program that I was at, they were the rock. They were that system that really helped me get through almost a year in the hospital, recovering from a couple rounds of rejection, from a coronavirus, pneumonia, and then also just being someone who has scleroderma and your body trying to figure out new organs. It wasn't an easy process, but with their help and my family's help, I learned to re-walk again. I got to meet a lot of incredible people, and I'm here today. So it's thank you. Finding strength in yourself and resilience in yourself through this process is incredibly rewarding. And so I just want to thank all of you here today who are supporting one of your loved ones with this disease. It's incredibly important for both our physical and mental well-being, but also completely rewarding for you, I hope. Thank you.
Well, thank you. I know these insights are incredibly valuable to everyone in this room and joining us online as well. We know that many people who come to conference for the first time have been newly diagnosed. And Monica, I wonder if you have any advice that you would share with them.
I think the conference is a bigger example that my suggestion is educate yourself. Learn about the condition, symptoms, treatment option can help you to feel more in control and prepared to manage. My second suggestion is build a support network. The support group help you and provide emotional support and share experience. And you're gonna receive practical advices from another has suffering the same to you. And the last one, find a healthcare professional with experience in scleroderma. I know this is a little hard, but a rheumatologist and a multidisciplinary team can provide a customized treatment according to your needs.
These are wise words from someone who knows, and we're grateful for you to share. So we've talked a lot about kind of the challenges and also just the incredible strength that you all have shown in your journeys. Erion, can you share kind of on the lighter side a little bit about how you practice self-care?
Yeah, self-care for me, I wanted to go back to work. I was forced out. So continuing to do my work. Now I'm a director of mediation. But at the time, I think I was group home manager for special needs, and then I worked at a prison release program. So still working with different populations. And then I'm an athlete. So I just tried to find ways. That was my self-care. So I was basketball and track, and now I do skiing. I've been rock climbing. I mean, they got these adaptive ways. So I wouldn't do them all. I wouldn't have done them when I was able-bodied. I wouldn't have done them without scleroderma, but I was just trying to find a way to supplement. And so I think I'm paragliding next month. So if y'all don't see me, you know what happened. So I went down the list of all the Paralympic sports. I even tried equestrian, but that just didn't look, that was just me not looking. I didn't feel good about that. Just imagine me on a horse, dancing on top of that, so I just gave that one up. But yeah, so that's my self-care, just finding a way to do what I love, even if it's in a different capacity. I coached a wheelchair basketball team that won the championship, but I can't play. So yeah, just modifying my life.
Amazing. And one thing about Erion, we know he's going to look good doing it. I heard that sneak in there. They had to look good doing it. Well, thank you for sharing that. Monica, I'm going to start with you on this one, but I want you all to think about this. We know we need to increase awareness about scleroderma, and we know that there are a lot of myths and misconceptions around scleroderma. What are some that you would like to dispel with our group today? Monica, can you start us off there?
Somebody said, yeah, there is no treatment for scleroderma. I thought there is no treatment specific for scleroderma. There is no cure for scleroderma, but various treatments are available to manage our symptoms and improve quality of our life. These include medication, physical therapy, lifestyle changes, in some cases, surgical interventions. In my case, I have to take 18 pills daily to manage my condition. I have been in total parenteral nutrition for over 10 years. I have to assist cardiopulmonary respiratory sessions once a week, and I have to check my pacemaker once a year. Despite these challenges, I live a very happy life and hoping they find a cure for scleroderma.
Amazing. Thank you. Evan, what myths or misconceptions would you like to address today?
Well, I briefly touched on this, but it's something that I hold pretty dear to my soul, is with scleroderma, you'll hear from doctors, medical professionals, that you need to start limiting what you do. And that's a very specific word. And it's a word that I don't actually like to think about when thinking about my disease. Limiting is something, that can affect your life. I like to think of it as metering your energy, metering what you can do that doesn't destroy you at the end of the day. But limiting is something that you should not do. Don't limit yourself to what is acceptable by medical in medical terms. But much like Erion, right? I mean, his list is outstanding. Something I should probably get on. But a thing that I find in current life is I'm a high school lacrosse coach, and as much as those young men get under my skin sometimes, that bit of the spring, those 2.5, 3 months, is kind of the best and happiest part of the year for me, beyond my family and my wonderful fiance. But they really, I look forward to it every year. And although it takes a lot of energy, and it takes some weekends, and it's pretty much every afternoon, evening for a good 10 weeks, 12 weeks. It's something that in my core I really need, and gives me a lot of joy. And although the medical community, and rightfully so, would say, well, high schoolers are full of germs, you're more likely to get sick, and they are, and it's true. But being outside, and just running around with them, it's great for my physical being and my mental being, and so my thing would be, don't limit yourself to what you think you can do. Do what you want to do. Just understand that there are the need to kind of understand your own energy levels, and then what you feel obviously safe and secure doing.
Thank you. Now, Evan, I'm going to stay on you just a minute because you used a word in that sentence, fiance. When did that happen?
That was about almost 5 weeks ago now. Thank you.
Congratulations.
Thank you.
So I would say you're not limiting yourself at all. I'm very focused on the future.
No, not. And she and I just got back from a 2-week trip to Italy, which was incredible. Hot, but incredible.
Awesome. Well, thank you for sharing that, and congratulations. Falguni, what myths or misconceptions kind of make you crazy and that you want to kind of address with our group today?
So a lot's been said, but let me piggyback off what Evan had said. I think they do say, right, this is a chronic disease. You have to take it easy. But only you know your body, right? You live it every single day. So what I've learned is take the precautions. Even my doctor would say, well, you know, I wouldn't go there, I wouldn't do this, but take the precautions. I'm here today, right? And most importantly, I love to travel. So do what you want to do. You know, we're going to go to Ireland this year. Last year I went to Portugal, and I went back to the UK, because when I got sick, I thought this was it, and I'm not going to be able to travel, but I did. So I would say is don't confine yourself, but you know your body. Take the precautions, do what you love, because that brings you joy, that heals your body, and that will take you many, many years to come, because and don't read what's on Google, right? Talk to your doctor. Yep. I was doing all this searching. Oh, it's going to reduce your lifespan by 10 to 15 years. Diffuse scleroderma, you need to stay at home. But don't, right? Wear that mask, get your shots, right? And do what you want to do, and love yourself. That would be
awesome. Thank you. I think that's a big conference takeaway is do not Google. Falguni, staying with you for a minute, how do you stay informed and proactive about managing your health care?
So I am very active now. I have a strong voice. So I talk to my doctors. I understand what's going on. I look at our National Scleroderma website. I'm also subscribed to the Scleroderma News, what's going on there. I also look at resources in terms of research at the Scleroderma Research Foundation, because we are one form, but there are many other forms of information that you can get. I had an opportunity to talk to one of the nephrologists in the UK. So they have the UK Raynaud Scleroderma Centre. So I'm subscribed to that news as well. So for me, it's really be your own advocate and looking out there. And then most importantly, working with all of you, right? My support group, people that I've met. Oh, I didn't know this was happening, right? What can we do here? And just staying engaged. You have to, you own your own destiny. And the more you understand your disease, the better you're going to, the outcome.
Awesome, thank you. So I have one final question for each of you, and Erion, I'll start with you. I'd love for you to share one word of hope and encouragement with everyone here with us today.
If I chose a word, excuse me, it would be active. Staying active for your physical health and your mental health. It also encourages the people around you to support you, encourage. So I just tell people to stay active as much as you can.
Falguni?
Perseverance. Persevere. Every day's a new day. So persevere, wake up, put a smile on your face, put your 2 feet down, and just persevere.
What about you, Evan?
So my one word or phrase would actually be wild thing. It's silly, I know, but it actually comes from my favorite poem by D.H. Lawrence with the same name. And if you will, I'll share it. So slightly paraphrased here, but I never saw a wild thing sorry for itself. A bird will fall frozen dead from a bough without ever having felt sorry for itself. And although being a little bit dark and bleak, it really challenges us not to look to the future or focus on what if, but really to stay grounded in the now, living in the moment, and living our most authentic life without that future fear. Yeah.
Thank you for sharing that. Monica, What about you?
For me, the phrase for today, all patients with scleroderma, is that the scleroderma doesn't define you. We are patients with a condition, but we are not scleroderma.
Incredible. I want to thank each and every one of you. You have been just absolutely amazing. I appreciate your insights, your thoughtfulness, your passion, and just how much you continue to serve our community by sharing your stories with all of us. And I'm going to ask you to stay put, but please join me in thanking our panel.